When you're in a room with another person, chances are you're breathing in some of their exhaled air. And if that person has a disease like COVID-19, you could be breathing in infectious air. As the US starts to move through new phases of the pandemic, many states are starting to reopen indoor dining and other shuttered indoor spaces. Public health experts say it's way too soon, but still many restaurants and bars are moving ahead. One way they're trying to keep things safer is by improving the ventilation so that any potentially contagious exhales quickly gust away. But how do you test for ventilation? One way is with a carbon dioxide monitor, like this one. Our exhaled breath is full of carbon dioxide, and we want there to be as little exhaled breath in a room as possible. So it's not a perfect check, but we can use a CO2 monitor as a proxy for how much potentially infectious air is around. We want to see how the spaces we frequently visit stack up. So, equipped with this CO2 detector, we're going to hit the streets of Brooklyn, New York. Hello.
Hola.
Before heading out, we checked in with Jose Luis Jimenez, a professor at the University of Colorado Boulder and an expert in how tiny disease-causing particles spread through the air.
We're breathing the virus in, especially in two situations: when we talk to someone very close, especially without a mask, or when we share the air in a room. And ideally, we will have some kind of machine that will start beeping when the virus was in the air, but that's not doable at present. But we have something else that we can measure, is we can measure carbon dioxide.
He explained that the outside air naturally has around 400 parts per million of CO2. Anything above that, and people's exhales are floating around. The higher the number, the higher percentage of the air is coming from other people. So let's test this out. So just sitting in my apartment with me breathing on it, we're up around 900, which is pretty high concentrations of carbon dioxide. So let's open the window and see if we can get some air flowing and see how far that drops. Okay, and so after some time with the window open, it's dropped down to 542. Ideally, we want as close to outside levels of CO2 as possible. But that's a bit unrealistic, Jose Luis told us, because once you go inside, at least some air is going to be trapped. He said a benchmark of around 700 is what we should be looking for.
We give 700 as a limit because it's pretty low and it's achievable in most places.
With all that in mind, I put on my coat and headed out into the neighborhood. First stop, the park. We're gonna get as far away from cars as it's possible to do in Brooklyn. So in the middle of Prospect Park, we're at 445 parts per million of carbon dioxide. We're in the middle of this field though with no cars around, few people, so makes sense it dropped a little bit. Next, we hit up someplace a little less vacant. So right now we're right in the entrance to the subway. We're at 483. We're on the subway platform.
This is a Brooklyn House, Flatbush Avenue bound 2 train.
So we're just in the subway car, stopped, and the thing went up. We spent the rest of the day wandering through grocery stores, restaurants, and shops. All told, we visited over a dozen places and recorded our readings. Here's what we found. My local grocery store clocked in at 584 parts per million of carbon dioxide. A second grocery store was a bit higher, but under 800. The first bagel shop was about 600, and the second wasn't far off. This is the second bagel store. Most shops and bars, even the ones with people eating inside, ranged from around 500 to 700 parts per million. One, though, raised my eyebrows. An indoor bar with a reading over 1,000. This is one of my favorite bars. We ran our numbers by Jose Luis, who said they were, for the most part, not concerningly high.
I think from the point of view of airborne transmission, this is not bad. We've been recommending to keep the levels below 700 when we share the air, and I see a few, 702, 709. The one that is like 1,000, there's another one at 900. Then those start to be concerning.
And that bar that was over 1,000, in some countries, that would be illegal.
So for example, in Taiwan, in South Korea, in Portugal, before the pandemic, it was not legal to be above 1,000, right? In the US, that had not arrived yet.
Now, these numbers have their limitations. For starters, ventilation isn't the only measure of risk. Picture 2 rooms, one full of masked people who aren't talking that much, and another full of chatty, mask-less people. Both groups of people are exhaling CO2, and the mask doesn't change that. If it did, we would suffocate. But the lively maskless room would be riskier. The numbers just don't show it.
You have 1,000 ppm CO2 in a restaurant where people are talking without masks. That's more dangerous than you have 1,000 ppm in a library where people are not talking and they're wearing masks.
Also, none of the spaces we visited were at their capacity limits. On the day we collected data, New York City restaurants were open at just 50% capacity, but the places we tested looked even emptier. So all of these spots could have greater CO2 readings at different times. But even with these limitations, ventilation monitoring can be really useful to owners of bars, restaurants, and other indoor spaces. They can see how many people can be inside before carbon dioxide levels start to climb. That might ultimately keep people safer than occupancy limits, because not every building is the same.
Like the two that you measured, one was very well ventilated and the other one is poorly ventilated, right?
Indoor dining will never be entirely safe, but people are still going to eat in restaurants if they're open. Monitoring ventilation won't stop the spread of disease, but it can help owners and patrons manage risk. And it can remind us all about strategies as simple as opening a window. It is cold. It really picks a great day for this.